This morning, the FDA and CDC announced they are recommending a pause in the use of the Johnson & Johnson COVID-19 vaccine. Our Nixon Norman tells us why and what this means for the Tennessee Valley.
The FDA and the CDC have pressed pause on the use of the J&J vaccine. But why?
Together, the CDC and the FDA are reviewing data involving 6 reports of a rare type of blood clot called cerebral venous sinus thrombosis, or CVST, in combination with low levels of platelets in the blood, called thrombocytopenia, in women ages 18 to 48 who presented with symptoms between 6 and 13 days after receiving the Johnson & Johnson or Janssen COVID-19 vaccine.
This type of blood clot is extremely rare, but the treatment is also different from typical blood clots, which concerns healthcare workers.
The FDA will revise the fact sheet for healthcare providers administering vaccine and the fact sheet for recipient and caregivers for the Janssen COVID-19 vaccine to include this adverse event information to ensure that healthcare providers are able to make appropriate benefit-risk determinations for their patients.
Of the 6 clot cases seen in the U.S., 1 patient died and another is in critical condition. But the risk of this happening to most recipients lowers as time passes.
For people who recently got the vaccine within the last couple weeks, they should be aware to look for any symptoms. If you've received the vaccine and developed severe headache, abdominal pain, leg pain, or shortness of breath, you should contact your healthcare provider and seek medical treatment.
This is national news, but what does it mean for the Valley? Governor Ivey released a statement similar to the FDA and CDC. It is important to know that the adverse effects potentially stemming from the Johnson & Johnson shot have been extremely rare in the country. But out of an abundance of caution, Alabama is temporarily pausing these shots until we know more. Ivey says she commends Dr. Harris from the Alabama Department of Public Health for taking this step in our state. And Dr. Harris says this hiccup will not stop vaccination efforts in Alabama.
In terms of our total number of doses, it doesn't really affect that much. And we've given, 71,000 doses out of, around 2.1 million total shots so far. So it hasn't represented a large number of our vaccines.
More information is said to come out in the next couple of days, and we'll be sure to keep you updated. Putting the Valley first, Nixon Norman, WZDX News.